Let's talk about controlled drinking and alcoholism. Controlled drinking is the ultimate fantasy of most people with alcoholism. They would like to go back to the day when they used to be able to drink in some kind of controlled manner that was not pathological. Even though most people with alcoholism did have some point in their life where they were able to do this. At this point in their life, once they have an established diagnosis for the condition of alcoholism, it's really not possible anymore. This is because of what is called neuroadaptive changes. The brain has undergone changes from the heavy exposure to the alcohol that cannot be reversed. The brain becomes hypersensitive to drinking, even to small quantities of drinking. And even over time, the tiniest amounts of alcohol will cause an exaggerated reaction compared to somebody who does not have an alcohol problem. For this reason, controlled drinking is a recipe for relapse. Even the tiniest amount, even a sip of alcohol, will trigger a relapse. If not right away, very shortly after. Usually within days, usually not much longer than a couple weeks, but usually within days, if not hours. So controlled drinking is something that is strongly discouraged when there is a condition of alcoholism because it will set the person up for a relapse, if not trigger a relapse immediately. Beverages such as odules and other forms of non-alcoholic beer or even non-alcoholic wine is also discouraged because they have a small amount of alcohol that is enough to trigger a relapse, and because they look and they feel and they smell and they often taste like the real alcoholic beverage, those other forms of sensory stimuli will also trigger a relapse in a person because they're simply conditioned to respond to the look, the smell, the feel, and the taste of alcohol and alcohol containers.